They found him alone, slumped gently forward in his recliner. No signs of pain. No cry for help. The TV still glowing. His robe still open. Just silence. It wasn't sudden. It wasn't violent. The official report listed natural causes. But I've seen this story before. Too many times. And to those of us who understand the deeper signs, this wasn't just nature taking its course. It was something else, something silent, something preventable. What took him wasn't a heart attack or cancer. It was what I call silent hormonal collapse, the slow unraveling of a man's body and mind, not because of disease, but because of long-term neglect of a vital part of his health. And he's far from the only one. Every year, thousands of men over 60 begin to lose energy, sexual function, emotional drive, even their sense of identity, quietly, subtly, without ever realizing why. Here's the truth. For decades, society has told men that once you reach a certain age, you should stop thinking about sex, that masturbation is shameful, that it's childish, that it doesn't matter anymore. But after 40 years as a board-certified urologist and men's health specialist, I can tell you with full confidence, it does matter. I'm Dr. James Carter. I've spent my career sitting across from farmers, veterans, engineers, and grandfathers, strong men who came to me, tired, frustrated, and confused. They weren't dying from disease. They were fading from within because no one ever told them what happens when you stop engaging with your own body. Not obsessively, just respectfully, consistently. This isn't about lust or addiction. It's about function flow hormones and dignity. In this video, I'll walk you through the 4 biggest and most overlooked health consequences that can happen when older men stop masturbating. And more importantly, I'll show you how to prevent them before it's too late. Because this isn't just about sex. It's about circulation, hormone balance, prostate health, mental clarity. It's about keeping the parts of you that still matter alive. So if you're watching right now, stay with me. This is a conversation you've probably never had before, but it just might be the one that changes everything. The first and most dangerous physical consequence of stopping sexual activity after 60. Let's talk about your blood flow, and the real reason use it or lose it is more than a saying. I can't count the number of times a man in his late 60s or early 70s has sat across from me, puzzled and anxious. He'll say something like, "Doc, I feel fine, but I haven't had a spontaneous erection in over 6 months. No warning, no signs. It just stopped." And that moment, it terrifies them. Not because they're trying to impress anyone, but because something that used to happen without thinking is suddenly gone. It shakes their confidence, their sense of manhood, and even their emotional well-being. And here's the thing. Most of them had no idea this could even happen. Why would they? No one ever told them that sexual function is tied directly to blood flow. And just like your legs or your heart, if the blood stops flowing regularly, tissues begin to suffer. Let me put it as plainly as I can. Your penis is not just a symbol of masculinity, it's a vascular organ. It requires regular oxygen-rich blood flow to stay healthy. And that doesn't just happen by accident. It happens through stimulation, through circulation, through use. When a man stops engaging in any sexual activity, especially after age 60, something subtle but dangerous begins to occur. Blood flow decreases. Oxygen delivery slows. The tissues begin to stiffen, not in a good way, but in a pathological way. This is how fibrosis begins, when the tissue starts to lose elasticity and responsiveness. Think about it like this. If you stopped using your legs entirely for 6 months, what would happen? You'd lose muscle tone, coordination, strength. Eventually, you might even struggle to walk without assistance. Now imagine what happens to an organ that's even more sensitive to blood flow and oxygen than your legs. It doesn't just pause, it begins to shut down, silently, gradually, and for some permanently. Morning erections disappear first. Then arousal becomes weaker, slower, or absent altogether. Eventually, even medication doesn't work, not because the medicine is wrong, but because the foundation has already eroded. This is when men come to me in quiet panic, asking, "Is there any way to get it back?" And the answer is, sometimes. If caught early with the right therapy, exercise, diet, and a return to consistent sexual activity, some men recover partial or full function. But for others who wait too long, it becomes a permanent loss, not just physically, but emotionally too. And I want to be clear here. This isn't about sex drive. It's not about ego. This is about vascular health, neurological response, and self-worth. Keeping things active even just once or twice a week helps preserve not just circulation, but confidence. Because when you stop using this part of yourself, your body starts assuming it's no longer needed. And once that happens, getting it back is a much harder fight. Now that we've talked about circulation, let's go one layer deeper into the engine room of your vitality, your hormones. What happens when testosterone stops getting the signal to stay alive? Let's talk about that in part 2. Let me tell you about a man named Richard. He was 72 when he came into my clinic, not because of any pain or performance issue, but because, in his own words, something just feels off. He wasn't depressed exactly, he wasn't sick, but he had no energy. His mornings felt heavier. He'd stopped going for his usual walks. He was eating less, sleeping more, and caring less about almost everything. What used to excite him, woodworking, football, even conversations with his wife, now just felt distant. This kind of case is more common than you think. Men who aren't in obvious distress, but are slowly becoming a duller version of themselves. So we ran some blood work, and sure enough, his testosterone had dropped by nearly 60% compared to just a few years earlier. Now, a decline in testosterone is natural with age, but this wasn't natural. This was accelerated. And when we dug deeper into his lifestyle, the answer became clear. Richard had stopped all sexual activity, including masturbation, over 2 years ago. Not because of any trauma or illness. He just assumed that at this age, it's not necessary anymore. But here's what most men don't know. Sexual activity isn't just about pleasure. It's about maintaining hormonal rhythm. When you engage in arousal, even solo, your brain gets the signal to stay in balance. Dopamine rises. The hypothalamus lights up. Your testicles are told, stay in the game. We still need you. But when that signal stops coming, when weeks turn into months without any activity, your body starts to get a different message. Shut it down. We're done here. And it begins to scale back hormone production. Not just testosterone, but the very chemical messengers that regulate mood, energy, even cognitive clarity. Low testosterone doesn't just mean lower sex drive. It means weakening muscles, brittle bones, mood swings and depression, brain fog and forgetfulness, and in some cases, increased risk of heart disease and stroke. I've had men sit in my office and say things like, "Doc, I don't even feel like a man anymore," and I don't take that lightly. The worst part, most of it is preventable. No masturbation won't cure low testosterone, but regular sexual stimulation, solo or partnered, can help maintain natural production longer than most medications can. And it's free. It's safe. It's already built into your biology. Just like Richard, thousands of men are unknowingly drifting into hormonal collapse, not from disease, but from silence. And by the time they feel the change, the damage is already well underway. Now that we've uncovered the hormonal connection, let's look at the physical consequence that's even harder to ignore: what happens when your prostate becomes congested. Most men think it's a bladder issue, but the truth is far more revealing. Let's talk about that in part 3. It started as a dull ache. George, a retired mechanic in his late 60s, thought he'd pulled something lifting boxes in his garage. But weeks passed, then months. The ache didn't go away. It settled deeper, into his lower back, his groin. A strange pressure in his pelvis he couldn't quite explain. And then came the frequent nighttime urination. Then slower flow. Then a lingering discomfort that made long car rides and even sitting through church service unbearable. He assumed it was a bladder issue, maybe even an early warning sign of prostate cancer. So like most men, he waited until he couldn't anymore. When he finally came to see me, we ran the tests, and what we found wasn't cancer. It was congestion. See, your prostate isn't just a passive gland tucked away in your body. It's an active, fluid-producing organ. And that fluid, seminal fluid, it's meant to move. It's meant to flow out regularly. But when sexual activity stops completely, especially after age 60, something happens that few men have ever been taught. The prostate gets backed up. When the gland isn't emptied regularly through ejaculation, the fluid it produces begins to stagnate and thicken. The ducts become swollen. Pressure builds. And low-grade inflammation creeps in slowly, silently, and persistently. We call this condition prostatitis inflammation of the prostate, and it's more common than you might think in aging men who've stopped all forms of sexual release. What does it feel like? That nagging discomfort in your lower back or groin, the constant urge to urinate even when your bladder's empty, disrupted sleep, burning or pressure. When you pee, even a subtle sense of irritability or fatigue you can't quite explain. Here's the kicker. In many cases, this doesn't require medication. What it requires is movement, specifically ejaculatory movement. One of the most effective ways to reduce prostate congestion is simply to keep the system flowing. Even just once or twice a week can help flush out built-up fluids, reduce pressure, and minimize inflammation. And the long-term stakes, they're even bigger. Research, including a well-known Harvard study, has shown that regular ejaculation is associated with a lower risk of prostate cancer. The theory is simple. Flushing. The prostate reduces the buildup of potentially harmful substances. Stagnation, on the other hand, may increase inflammation and risk over time. I once treated a man in his 70s who hadn't had any sexual release for nearly 2 years. He thought that chapter of life was over. But when his PSA levels spiked and we ran more tests, we found a prostate so inflamed and swollen it was practically choking itself. And all of it might have been avoided with a small, simple habit he had been told wasn't necessary anymore. Now, physical symptoms like discomfort and pressure are one thing, but there's a consequence, even more devastating one, that affects your sense of identity, connection, and worth. Let's go deeper in Part 4, where we talk about the emotional disconnection most older men never see coming. There's a kind of silence that doesn't show up on blood tests, a kind of quiet that settles not in the body, but in the spirit. I once had a patient named Earl, 75 years old, widowed, soft-spoken. When I asked what brought him in, he hesitated, then said something that stuck with me to this day, Doc. I feel like I'm disappearing. Earl wasn't sick. His heart was fine. His labs looked okay. But he no longer recognized the man in the mirror. He had stopped engaging in sexual activity years ago, no intimacy, not even with himself. He told himself it was just part of getting older, that it didn't matter anymore. But it did. Because somewhere along the way, Earl lost more than just his sex drive. He lost his sense of being alive. You see, when older men give up masturbation not out of choice but out of assumption, they slowly cut off one of the last remaining connections to themselves, to their identity, to their vitality, to that deep private sense of, I'm still here. This isn't about lust. It's not about fantasy. This is about neurochemistry, about the hormones and signals that shape how we feel, think, and relate to the world around us. When you engage in sexual activity, even solo, your brain releases a cascade of chemicals. Dopamine, which drives motivation and pleasure. Oxytocin, which fosters connection and emotional warmth. Endorphins, which reduce stress and enhance well-being. These aren't optional substances. They're critical to mental health resilience and emotional clarity, especially as you age. Without them, men become more prone to depression, isolation, mood swings, apathy, and even early cognitive decline. I've watched once vibrant men grow quiet, not because life dealt them a harsh blow, but because over time they disconnected from the very thing that once made them feel human. No one teaches men how to grieve the slow loss of self that comes with emotional numbing. No one warns them that stopping all intimacy can slowly erode their joy. their confidence, their spark. You'll see it in the way they walk, the way they stop looking in mirrors, the way they answer, "I'm fine," when they're anything but. And it breaks my heart, because most of this is preventable. What these men needed wasn't therapy or pills, it was permission. Permission to reconnect, to feel, to express, to remember that they are still worthy of pleasure, of touch, of emotional presence, even if no one else is around to share it. Because at the end of the day, this is about self-respect. And when a man stops tending to that quiet part of himself, the part no one else sees, he begins to fade. But here's the good news. It's not too late. In the next part, I'll show you exactly how older men can rebuild their connection to vitality with simple, practical steps backed by science and proven in the real world. Let's talk about the way back in part 5. Let me start with this. It's not too late. I've seen men in their 60s, 70s, even late 80s who thought they had lost that part of themselves forever. And then, with the right approach, they came back to life. Not just sexually, but emotionally, mentally, and even physically. The good news is, you don't need to overhaul your entire life. You don't need to feel like you're 25 again. What you do need is consistency, permission, and presence. So let's talk about how to begin gently, respectfully. 1. Start with intentional self-connection. You don't need to schedule it like an appointment, but once or twice a week, give yourself permission to explore your body without guilt or rush. This isn't about fantasy or performance, it's about reigniting the neural and hormonal circuits that have been asleep. Focus on what feels good, not what looks good. Quiet setting, no pressure, no shame. This is about telling your body, "I'm still here. I still matter." 2. Avoid overstimulating pornography. If your goal is to reconnect with your real biology, not just visual stimulation, try avoiding extreme content. Many older men report that after years of relying on porn, they feel disconnected from their natural arousal cues. Instead, consider gentle stimulation without screens. Or, if visual aid helps, choose content that reflects intimacy rather than performance. 3. Pair this with healthy daily habits. What you do outside the bedroom supports what happens inside. Light exercise boosts circulation and testosterone. Good sleep resets your hormonal rhythm. Balanced nutrition supports sexual and cognitive function. Stress reduction, like breathing exercises or mindfulness, enhances performance and recovery. Sexual health is never isolated, it's part of your whole system. 4. Track progress without pressure. Notice small signs. Morning erections returning. Increased energy or motivation. Fewer nighttime trips to the bathroom. More positive mood. You're not aiming for perfection. You're looking for momentum. 5. Speak kindly to yourself. This is perhaps the most overlooked practice. You're not weak for wanting to feel connected. You're not selfish for desiring pleasure. You're human, and your body is still listening. Remember, you've spent decades carrying responsibilities, providing for others, showing strength. Now it's time to offer some of that care back to yourself. I once had a patient named Ben, 68, who told me he hadn't felt like a man in years. With a few small changes and a shift in mindset, he came back a year later and said, "Doc, I don't just feel like a man. Again, I feel like myself." And that's the real win. Now, to wrap this up, let's go beyond science and habits. Let's talk about why this matters on the deepest level. Not just for your health, but for your dignity, your spirit, and your sense of self. Let's finish strong in part 6. Let me say this clearly, this was never about lust. It's about life. It's about your circulation, your hormones, your prostate, your mental clarity, and most importantly, your identity. There's a myth that too many older men carry deep in their hearts, that intimacy, pleasure, and desire are things we're supposed to outgrow, that with age comes quiet acceptance, even surrender, that choosing to let that part of yourself go is somehow noble. But I've spent over 4 decades working with men in their 60s, 70s, and 80s, and what I've seen time and again is this: It's not aging that destroys vitality, it's abandonment. The slow, silent belief that this part of you no longer matters, that you're done. But here's the truth I need you to hear. You're not done. Your body still remembers, your mind still responds, and your soul, yes, even now, still longs to feel whole. So if you've been carrying guilt or shame or quiet confusion about why you feel less alive lately, I want to gently challenge you to consider this. Maybe what's missing isn't youth. Maybe it's reconnection. Not to someone else, to yourself. This isn't about impressing anyone. It's not about chasing some version of masculinity from the past. It's about honoring the man you still are, the one who deserves to feel present, powerful, and complete. Because when you choose to care for your sexual health, you're also choosing to care for your cardiovascular health, your testosterone stability, your prostate function, your emotional resilience, your joy. You are choosing life, not the kind sold on magazine covers, but the kind that lets you wake up feeling grounded, energized, and alive. I want to leave you with this. The most dangerous thing a man can do in older age is go silent about what matters most. And for too long, this topic, male intimacy after 60, has been buried under shame and silence. Not anymore. If this message stirred something in you, if you feel even a flicker of recognition, you're not alone. There are thousands of men out there just like you, quietly wondering if they're the only ones. You're not. If you made it to the end of this video, type 1 in the comments. Let me know you're here. Let me know you care. And if you're still unsure, type 0 and tell me what's holding you back. I read every comment because this isn't a performance, it's a conversation. You've spent a lifetime caring for others. Now it's your turn. Your body still works. Your mind still matters. And your story, it's still being written. You're not too old. You're not too late. And you're not done. I'm Dr. James Carter, and I'll see you in the next video.